So I think every nurse is going to say Florence Nightingale, and I do, but Clara Barton, who founded the Red Cross here in the United States, she actually went over to Europe and brought the Red Cross back for what we know now today as the American Red Cross. But she started on the battlefields during the Civil War and jumped in and did nursing and provided that aid. But it's the holistic approach that kind of symbolizes the Red Cross and the work she did. The very physical, in the moment, what are the medical needs, but then also looking at her patients holistically and how to support them on their recovery, their psychosocial aspects as well. And that's really something that nursing strives to do, is really look at that patient and the totality of their disease, both urgent and then afterwards. Interestingly enough, it started when I was in the 6th grade. We had to do an assignment where we traced a drop of blood through the circulatory system, and I was enthralled with the heart and all things cardiac. So I actually started as a new grad nurse in a cardiac step-down unit and worked in intensive care and cardiovascular services in the hospital for about 5 years. And it became very clear early on that a large majority of my patients in the cardiovascular unit were living with some form of diabetes. And so after several years, decided to make that switch to outpatient to see if I could help prevent patients from having the comorbidities that I was treating in the hospital. So I switched to adult endocrinology and became a certified diabetes educator. And about 5-6 years ago, as more and more drugs that were initially brought to market for type 2 diabetes and glycemic control were found to have cardiovascular outcomes, my two worlds sort of collided. And I was very fortunate to help Dr. Mikhail Kosoborod here in Kansas City open up our first cardiometabolic center at St. Luke's, and combining my two passions of cardiovascular and type 2 diabetes. And now I'm the program director of the Cardiometabolic Center Alliance, which is a healthcare consortium across the country based on the model that we started and still work in today in Kansas City. I think we're getting there as far as comprehensive care. I think historically, as our specialties grew, we all did very well in our own specialties. We had nephrology, we had cardiology, we have endocrinology, and hepatology, but we weren't really doing that crosstalk. So I think one of the things that both Dr. Kosoborod and myself and our peers across the country who are involved in cardiometabolic centers have echoed is that this is the most satisfaction as a practitioner that we've had in years. This coordinated approach that really looks at the cardiometabolic renal patient in its totality, and breaking down those silos and delivering care in a very coordinated manner across the entire disease spectrum, not just focusing on glycemic control or heart failure or NASH or obesity, but looking at it as an entire disease entity in itself. And I think that's what's really needed to take on a whole population health initiative and make a big impact in the growing population of patients that are living with this disease that we now call cardiometabolic renal disease. I think it can. I think EMRs have made a world of difference. From an old school nurse who 30 years ago was trying to decipher physician writing in a paper chart, definitely a huge improvement. But you get out of health records what you put into health records. And I think it's very important to have that coordinated approach to not only the visit, but the visit follow-up. How do you communicate with your peers electronically? And how do you communicate with patients? I think one of the most advantageous things of the EMR between crosstalking with health systems is how we can crosstalk with our patients and allowing patients the visibility into their health record, but also pushing things through patient portals after visit summaries. Letting the patient be able to communicate right into their EMR or their chart, I think has made a big difference in how we can further assess where our patients are and help implement more pathways to coordinated care. I think the sky's the limit. I think, involving digital technology, sometimes we get a pushback to say, our patients aren't savvy. I think our patients are often more savvy than we are. Everyone is consuming some form of digital technology now, and anything that opens up access to care coordination, provider services to our patient is a benefit. We're using a lot of digital health platforms for educating patients, for remote patient monitoring, and virtual visits. I think one of the only positives to come out of the recent pandemic was the fact that we had to adapt very quickly to technology and do virtual visits. and allowed those patients that might not have had a chance to see a practitioner or come into the clinic now actually have that virtual technology at their fingertips to have better, longer conversations with healthcare providers and their care coordinators virtually. So I think more to come on that, but very excited about what the future holds. So I came across Cardiometabolic Health Congress in one of my professional email blasts that showed that there was actually a course that I wanted to attend, and got to know the team there, who's fantastic. Spent some time with them and actually went to one of their spring symposiums, their annual meetings, and was just blown away by the quality of the education, but also the quality of the faculty that they have working with them. It's the key opinion leaders, the who's who, the thought leaders in diabetes, cardiovascular, obesity, lipids, heart failure. It was very refreshing to go to a course that I came away with a deeper understanding of all of the different disease states and sequelae that my patients are living with, rather than having to go to multiple different classes or different courses. So it's that combined focus on the entire patient and the entire disease state that I think makes it so impactful and so meaningful. So a typical patient that I still see every day in clinic would be someone living with type 2 diabetes that's also unfortunately living with obesity, hypertension, hyperlipidemia, has some visceral adiposity, so maybe some fatty liver disease, as well as the potential for some heart failure or diabetic kidney disease. These are folks that we see every day, day in and day out. And historically, 25, 30 years ago in my practice, I would have focused in on one thing. It may have been that we were seeing those patients for their glycemic control. And certainly we would have made sure that they were on guideline-directed medical therapy for hypertension and lipids, but we didn't take the onus of that. So our patients often had to see multiple providers, keeping multiple sets of instructions clear, and which appointment do I go to, and which physician fills this medication, and who do I talk to about my blood pressure, and who do I talk to about my blood sugar, and who do I talk to about my shortness of breath from my heart failure. And I think what we're doing now in a very care coordinated, holistic view for that patient is giving them a one-stop shop and letting them feel like they're part of that team, but they have a centralized care coordinator and they have a practitioner team that's going to take care of all of those needs in that cardiometabolic renal space. And we typically hear, at least once a week or twice a week from our patients, why didn't someone do this before? I feel like I have a connection now to where I know who I need to call for any of these things that I'm facing with my healthcare. So a much more streamlined approach, leading to better outcomes because patients feel like they have a little bit more control. And we see a little bit more adherence because there's an understanding of what the patients need to do and the care that they need to help provide for themselves as well. So it is a great question because healthcare has always been stressful, but we know even more so since the pandemic in the last couple of years, we're all understaffed and overworked. But I think the thing that I focus on and that my team focuses on is that, anyone sitting across from me on that table or in that chair could be a family member. And really, putting on that patient experience to yourself and realizing that this could be my loved one and how would I want them treated and how would I want them to get through the process in the most meaningful way to ensure they have a good outcome. So just realizing that we're all in it together, as corny or as cliche as that may sound, but that could be your loved one, and really providing that sense of care and treatment plan that I would want my loved ones to experience as well.